As a delivery system for accelerated partial breast irradiation, the SAVI applicator combines the tissue-sparing dosimetry of interstitial brachytherapy with the single-entry ease of balloon brachytherapy. This hybrid approach is designed to maximize ease of use during placement while providing more flexibility in the delivery of the radiation dose.
Because you have different ways to load your radiation therapy, you can basically sculpt the radiation and avoid normal tissues that you don't want to receive a full dose of radiation, such as the skin, heart, lung, ribs. Because partial breast is an option for women with SAVI, it can lead to more women being able to have breast conservation and not have to choose a mastectomy because they can't get to the radiation facility for whole breast radiation therapy.
The process begins with a pre-placement CT scan to delineate the size, shape, and orientation of the tumor cavity. Having these images readily accessible at the time of insertion will assist in the proper placement of the SAVI applicator.
The initial CT is really important because it helps you find the long axis of the tumor bed, plan your entry site, and since there are 3 actual sizes of SAVI, it helps you plan ahead of time which SAVI is best suited to your patient.
The insertion can be performed in your office or outpatient clinic, typically within 2 to 3 weeks after the lumpectomy has been performed. The procedure couldn't be simpler. Begin by using ultrasound to locate and measure the lumpectomy cavity, comparing your images with those obtained by CT scan. Determine the size and shape of the cavity. This information is important for determining the correct applicator size and the preferred angle of entry. The optimum placement for the SAVI applicator is to position the device along the long axis of the cavity. Using xylocaine 1% with epinephrine, anesthetize the skin, then the cavity under ultrasound guidance. A spinal needle may be necessary to reach a deep cavity or to anesthetize the distal wall of the cavity. In addition, the pathway taken by the spinal needle will also provide a reference for the correct angle of entry for the SAVI applicator. With the number 11 blade scalpel provided in the kit, make a 1 centimeter incision.
If you use the scar entry technique where the SAVI is actually going through a portion of the fresh scar from lumpectomy, you may want to reinforce the scar with a couple of interrupted sutures on either side of the SAVI just to preserve the integrity of the incision.
Insert the 8mm trocar through the incision and into the tissue under ultrasound guidance to prepare a path for inserting the SAVI. The trocar should target the center of the cavity along the longest axis. As you remove the trocar, the seroma that accumulated in the cavity postoperatively may drain. Prior to inserting the applicator, test the SAVI applicator by fully expanding it. Note that each catheter has a purple catheter protector to maintain the integrity and dryness of the catheter. Do not remove these inserts. Insert the expansion tool into the fitting at the proximal end of the applicator and rotate the tool clockwise, counting the revolutions until you hear the click that indicates the device is fully expanded. Close the device by rotating the expansion tool in a counterclockwise direction. Under ultrasound guidance, insert the applicator into the track previously created by the trocar and advance it until the distal end is anchored in the far wall of the cavity. Gently rotate the expansion tool clockwise to start opening the catheters.
After insertion of the SAVI device, when you're about to expand, you want to give gentle forward pressure so the tip of the SAVI is very close or embedded within the distal portion of the lumpectomy cavity. And then with that gentle forward pressure, you then turn the stylet for expansion and feel for resistance. You can then look with ultrasound to make sure all of the struts are expanded. At times, after insertion of the SAVI on evaluation, one or more of the struts may not be fully expanded. When that happens, you can collapse the SAVI, remove that, open it up to make sure that it actually is working appropriately, then place it back in the patient breast and open up. At times, because of where the SAVI is placed in the breast or scar tissue or patient anatomy, you may see that the struts of the SAVI are splayed somewhat. One of the advantages of the SAVI is because you can plan with each individual catheter, that is not insurmountable and the patient is still a candidate for partial breast with SAVI.
Once the applicator is in place, remove the catheter protector from only the center catheter, and then remove the expansion tool. Carefully replace the catheter protector and dress the entry site appropriately. In most cases, 4x4 drain sponges and ABD pads will suffice. A surgical bra will provide support and comfort while holding the dressings in place. A CT scan is performed to confirm proper placement of the applicator. These images will also be used for creation of the treatment plan. Treatments are typically done twice a day and last about 10 to 15 minutes. After the last radiation treatment, the SAVI applicator can be removed in a minor office procedure by reinserting the expansion tool into the fitting and turning it counterclockwise to close the catheters. Once the applicator is fully collapsed, slightly rotate the applicator while applying gentle traction and withdraw. The incision is then dressed with steri-strips.
Some centers have found it more comfortable for the patient if they put a small amount of numbing cream around the entrance. I have not had to do that in my practice, but it certainly is an option.
With its ability to contour the radiation dose, the SAVI applicator allows physicians to treat patients who otherwise would have been eliminated as candidates for APBI.
Partial breast irradiation is very attractive for many women for the reasons we've discussed, but not all women are candidates. Again, if it's too close to the skin, you wouldn't be a candidate for Mammocyte. You would need the expertise and the OR time to do interstitial. And with SAVI, because you can avoid normal tissue, it expands the number of women that can choose partial breast as an option to treat their breast cancer.